Thank you for everybody for joining. Welcome to the webinar today. Uh, my name is José Zariffa. I'm a senior scientist at the Kite Research Institute in Toronto, and I have the privilege of serving as one of the associate editors for topics in spinal cord injury rehab, which is hosting this webinar series today. Um, as many of you will know, TSCIR is the official journal of Asia, and so it covers everything that would be relevant to Asia members. So it's a valuable resource for physicians, for allied health, the allied health team, for researchers, as well as industry and policymakers. And so we encourage everybody to read the journal and consider submitting your work to TSCIR. So in order to spotlight some of the work that's been published in the journal, we have started this webinar series. This is the second one in the series. We'll see a slide in a minute with some of the upcoming ones as well. And maybe we can put up those slides now, and then after that, I will introduce today's webinar. But for today, we are spotlighting a paper that was one of the, if probably the top most viewed paper in 2024. And so it's our great pleasure that Dr. Krassioukov has agreed to join us today and to present the work. I will just give you a quick introduction, well, as brief as it can be for somebody so distinguished. But Dr. Krassioukov is a professor at the University of British Columbia. He's the Patrick Reed Endowed Chair in Spinal Cord Rehabilitation there. He's an investigator at ICORD in Vancouver, as well as a staff physician at GF Straw Rehab Center in Vancouver. So he's a clinician scientist, very well known for his expertise in autonomic dysfunction after SCI. His work has been supported by pretty much every major funding organization supporting SCI research, and he's published over 300 manuscripts, books, book chapters, reviews. He was inducted as a fellow of the Canadian Academy of Health Science in 2010, and he has been awarded medals by the International Paralympic Committee for his contributions to the Paralympic movement in the 2010 and 2012 Paralympic Games. In addition to that, Dr. Krassioukov's links to Asia are strong and deep. So he's received numerous awards, including the inaugural Alan Brown Award from Asia. And he was the first Canadian elected as the president of Asia from 2018 to 2022, as well as then receiving the Asia Lifetime Achievement Award in 2025. He also, in 2025, received the King Charles III Coronation Medal. So thank you very much for taking your valuable time today, Dr. Krassioukov, to present your work to us, and I'll pass it over to you.
Thank you very much, José, for introduction. It's a long list of everything. Just confirming I'm a very old person.
Oh, sorry. Before you start, one more note, housekeeping note. For questions, everybody, please use the Q&A functionality rather than the chat, and then we will get to the questions in due time. Thank you. Go ahead, Andrei.
Again, it is a pleasure for me to share our work that was a production of and efforts of many, many colleagues around the world. And that's today I would like to talk with you about interesting topic very close to my heart, motherhood after spinal cord injury. As José mentioned already, numerous agencies support my research, and specifically this work was supported by Craig Nielsen Foundation predominantly. What we do know about motherhood, World Health Organization telling us that mother health refers to the health of women during pregnancy, childbirth, and postnatal period. Each of these stages should be a positive experience, ensuring women and their babies reach their full potentials in health and well-being. And also, with respect to breastfeeding, World Health Organization recommended that exclusive breastfeeding for the first 6 months. It's very important to assure safety and health of child. And then what is recommended after 6 months, that mother can add supplementary food. And then if there is milk still available, it's continuing up to 2 years. I will be interested to know how many moms today in the audience and how many of them actually continue to breastfeed for 2 years. I know that my daughter, for example, was not able to continue feed for 2 years because mother has to go to work. and it was just impossible. And what we will see, it's totally different situation with women with spinal cord injury. That's why also I would like to state that what I learned from my patients, from interactions, from friends who become friends, that women are sexual beings. Doesn't matter if they have spinal cord injury or not spinal cord injury. And it means many aspects. First of all, being a lover, being a wife, being pregnant, experiencing childhood, and being a mother. And unfortunately, what we do know is that many of these aspects for the women with spinal cord injury sometimes are very challenging. That's why my objective today, to present you why physiatrists, why rehab specialists have to be interested and know about pregnancy and lactation. I will specifically also share you some interesting aspects of cardiovascular control in women during pregnancy, childbirth. And finally, I will give you some insight from the publications that was published in the topics. What are the challenges women with spinal cord injury experiencing during breastfeeding? First of all, I would like to tell you why I become interested in women's health after spinal cord injury. Many years ago, when I was a medical student in Russia, I was dreamed to become obstetrician. And I became obstetrician. Actually, my first clinical practice was in OBGYN. I delivered babies. I look after women with spinal cord injury. And one of my first research manuscript was about autonomic control of uterine contractions that occur sometimes on a threatened abortion situation. And this, almost 50 years ago, some kind of jolt my interest to the women's health. And then, of course, it's continued to women's health after spinal cord injury. I will ask you a question. Is it true or false? Female-specific studies of spinal cord injury are scared. And I believe everybody who is involved in rehab medicine of people with spinal cord injury know very well that great majority of research is conducted on males. As you can see here, this is my just PubMed search 2 days ago. During the last 10 years, there is more than 8,000 publications focused on male health after spinal cord injury. And not surprising, it is 10 times less publication focused on any aspect of women's health after spinal cord injury. So this is one of the challenging aspects that we still don't know a lot what's happening with women's health after spinal cord injury. And we have to definitely change eventually. But we do appreciate the fact that it's not surprising that women's health is so poorly investigated because of the numbers. And it's very challenging to conduct a large number studies involving big number of women with spinal cord injury. As you see here, data from US and Canada showing the same proportion. 79% males and 21% females in US, the same numbers in Canada. That's why everybody who is involved in clinical practice and research in spinal cord injury knows this data. It is challenging to conduct research in women with spinal cord injury. And I can tell you, in my last, 30 years of working in North America, I had numerous grant applications that was focused on women research returned to me back. Dr. K, we are not confident that you will be able to recruit sufficient number of females in your study. It was reality. That's what we will talk with you about today, and this is just highlights of major issues, how spinal cord injury affect women's health after spinal cord injury, and it's which related to fertility, pregnancy, or abilities to become mother, and then during the mother. First of all, there is a fertility challenges and insecurities. We will talk a little bit more about this. There is also numerous data shows that women's self-awareness and confidence and emotional issues about how they will be perceived as a woman on wheelchair and be engaged in a new relationship and so on, or in sexual activities. For example, orgasm is totally lost or decreased dramatically. Blood management, particularly during we know as a rehabilitation specialist, bladder challenges always occurring in people with spinal cord injury, but during pregnancies there are new issues upcoming, more frequently urinary infections and urinary incontinence. Similar situation with bowel management. Then, as belly will grow, with child growth, there is changes in habitus, and women with spinal cord injury experiencing significant challenges with transfers, positioning in a wheelchair, which was very comfortable before pregnancy. And here, physiatrists definitely have to be involved and help. And then, of course, typical hygiene issues. With grown belly, it is difficult to reach some parts of the body and be clean and so on. Changes in pain, spasticity, and autonomic dysreflexia, one of the most common and challenging and threatening events that are occurring with a growing baby, and particularly during the delivery. And finally, I will touch a little bit about challenges that we as a physiatrist facing when we have to help women who just learned that she is pregnant and she is on 15 or 20 various medications related to spinal cord injury, including baclofen, pregabalin, gabapentin, and so on and so on. And it is a challenges. I have to acknowledge that through my presentation, you will see numerous faces of patients of mine who participated in this actually publications. They were crucial parts of this publication. And here you see Mrs. Terry Thorson with her son, and then on a walk, Karen Hodge, one of my patients also and participant of this study. Let's talk a little bit about fertility issues. There are some misconceptions that for many years it was misconceptions that both men and women with spinal cord injury cannot have children. It's wrong. Yes, we do know that there is a short period of time, which approximately lasts 6 to 3 to 12 months of amenorrhea immediately after the injury, but eventually menses come back. And what's important to remember is that ovulation can occur in women with spinal cord injury before the menstrual cycle occurs. That's why it has to be advised women in early stages post spinal cord injury probably use contraception until she will be stable and ready to become a mother. Another challenges during the pregnancies with women with spinal cord injury, increased possibility of deep vein thrombosis. We do know that people with spinal cord injury predisposed to this in general, especially with acute period of time, acute post-injury. And pregnancy, unfortunately, increased possibility of developing DVT. I already mentioned challenges with urinary bladder. It is a well-established autonomic dysreflexia. Uterine contraction, and particularly delivery, is a very, very common issue triggering autonomic dysreflexia. And a very important aspect that sometimes is missed is that preeclampsia, which are also episodic hypertension, confused with autonomic dysreflexia. Triggers of these two conditions totally different, approach to management totally different. And during the last few years, I participated in numerous efforts to clearly describe autonomic dysreflexia in a pregnancy and management of in women with spinal cord injury. As you probably are aware, numerous documents available about paralyzed veterans of America on SCIR about episodes of autonomic dysreflexia in this population. Mobility and transfers problem. Again, it's a big issue which required support of physiatrists, occupational therapists, physical therapists with adjustment chair. And I know that numerous of my patients had to actually transfer from manual wheelchair to power wheelchair at the later stages of pregnancy to improve their mobility. Another very interesting aspect, a lack of awareness when labor will start. There is no sensation of uterine contraction. Typically, women will noticing episodes of autonomic dysreflexia developing. That's why this is another challenge women with spinal cord injury will experiencing before becoming mothers. Just one slide on medications. There are well-established group of medications that is not recommended, that's strictly restricted for pregnant women and general population, and you see above. And we do know some very negative aspects of effect of baclofen and pregabalin on children, babies, developing babies, and that's why we have to be aware and advise women with spinal cord injury either in advance of their pregnancy to switch to better medications that we can have, or unfortunately, sometimes we not have substitute. For example, pregabalin. Looks like effects of pregabalin quite significant on developing child, and we should recommend switching pregabalin to gabapentin or duloxetine, which has a better profile for developing fetus in a pregnancy in women with spinal cord injury. But it's a big, big topic. And the same issues, of course, coming to the lactation. During the lactation, we also have to be very careful what we continue to prescribe women with spinal cord injury who continue to breastfeed. So let's switch to the topic of cardiovascular control, which is very, very close to my heart, and it's what's specifically related to women with spinal cord injury who are experiencing pregnancy and developing babies. This is an example of 24 hours blood pressure monitoring reported by another laboratory. You see significant fluctuation during the day, very high blood pressure, 259 to 160, with very low blood pressure, 83 to 43, in a woman with T3, motor sensory complete injury with 33 weeks of pregnancy. And it's a typical pattern of blood pressure that we see in many people with spinal cord injury, but unfortunately with growing belly and increased size of fetus, it's additional challenge on cardiovascular control. This is example, this study we published from my laboratory. This is an example of blood pressure changes in woman, not pregnant woman, who is managing her bladder by unusual method. This is a study we conducted in Croatia when we collaborated with colleagues in Croatia. And this woman underwent our cardiovascular assessment, and suddenly she's developed symptoms of autonomic dysreflexia. And she stated, I feel that my bladder is full, I need to empty bladder. I expected that catheter will be inserted by caregiver, and unfortunately, caregiver told me we don't have catheters. We're doing expulsion of urine by putting pressure on the belly. Probably majority of you know this is an old-fashioned method known as Credé maneuver, which is totally inappropriate and should be prohibited for expelling urine from the blood. As you can see, your resting arterial blood pressure was 105 over 50 millimeters of mercury, very low, typical for this level of injury. And during the Credé maneuver, your blood pressure increased to 235. And as you can see on ECG, she also developed arrhythmia. This is a typical what we see if bladder managed inappropriately. But again, don't forget, this is what bladder experiencing with baby growing up, bladder putting more and more pressure, growing uterus putting more and more pressure on the bladder, and bladder respond very quickly with episodes of autonomic dysreflexia. That's why we see it all the time. Before we conducted our study on breastfeeding, we conducted our study just with general questionnaire of women around the world. This was collaborating effort with colleagues from Sweden and across Canada. We were very fortunate to get responses from 102 females from around the world who were pregnant once, or some of them were pregnant 4 times after spinal cord injury. And what's interesting is that women with spinal cord injury reported that during the breastfeeding period, up to 39% of them experienced episodes of dysreflexia, and majority were women with a high cervical and upper thoracic level of injuries. And I will come back to this issue. But this is a very common issue in women who experience pregnancy and then lactation with the spinal cord injuries. That's why we have to be aware about this and advise to women what to do in this area. Let's look on the situation, what's happening with growing baby inside of the belly of even a woman without spinal cord injury. As you can see here, the space in abdomen cavity become less and less and less available. And all gut, including bladder, will be squashed by growing baby. And this is a situation. So we actually, as a physiatrist, or including our occupational and physical therapist, also have to recommend, for example, what positions women with spinal cord injury should prefer during the sleeping or when she is resting. And I give you two possibilities, position one or position two. Unfortunately, I cannot word, but I'm just asking you mentally think which is position best for women with spinal cord injury to rest, supine on the back or supine on the side. Okay, I'll give you a second, and my answer, it's probably on the side. What we do know from physiology of women without spinal cord injury, when baby is growing and woman laying down or supine, uterus put a pressure on abdominal aorta and vena cava, as you can see in the first diagram in the red. And this result in significant delay of return of the blood from lower portion of the body, predisposing women with pregnancy at the end of the pregnancy to the swelling and edema in lower extremity and stasis in the lower portion of the body. However, if woman position on the side, pressure on abdominal aorta and vena cava decreased, and therefore there is a better circulation in the lower portion of the body. And you are well aware that with spinal cord injured women and individuals, we already have significant issues with swelling, edema, because there is a poor return of the blood from the lower portion of the body, and unfortunately, pregnancy is could significantly exacerbate this issue. That's a simple physiatry tricks. Think about posture, think about physiology, and accordingly advise what is the best. And the same situation also, even for women after pregnancy ended, position for the baby breastfeeding is very important, and we come to this issue slightly later. So this is the two major papers that resulted from our studies. It was lasted almost 4 years. It was a big international effort, and we developed separately clinical practice guidelines, which is focused for clinicians, and also breastfeeding guide for mothers with spinal cord injury. Both of these documents were published in Topics of Spinal Cord Injury 2024, but we also put additional pamphlet and the TSCIR. Some of you probably are aware about spinal cord injury research evidence that developed by international team, but based in Vancouver, Canada. And there, all this document available for free on websites. So first of all, I would like to introduce my international team who participated in this huge work. It was very interesting, exciting, but sometimes challenging effort, because I can see my colleagues and collaborators were spread all around the world, from South Africa, India, Italy, Greece, Denmark, Sweden, UK, US, Canada. And sometimes our coordinated meetings were at 8 o'clock in the morning in one side and at 2 o'clock in the AM in another side of the world. But we thrive, we progress, and as a result of our efforts, again, as I mentioned, we were able to combine, collect a significant number of reports of women with spinal cord injury. And what you can see here is that I already mentioned about frequency of autonomic dysreflexia in women with spinal cord injury during the breastfeeding was almost 40%. But what interesting was individuals with a high level of injury had breastfeeding period of approximately only 3 months. In comparison with people with a low level, women with a low level of injury had a typical recommended by WHO health period of breastfeeding up to 6.5 months. That's why, as you can see here, we definitely showed that breastfeeding is challenging for subpopulation of women with spinal cord injury with a high thoracic and cervical spinal cord injury. And I will describe you, we found why. So first of all, I will start with case presentation from my clinical practice. I had the pleasure to follow up this lovely lady who came to me immediately after the injury. She sustained C4 motor sensory incomplete spinal cord injury. She's an ambulator, she's AISD, and she sustained Brown Séquard type syndrome. As you know, one part of the body suffered from more motor and light touch dysfunction, and another part of the body suffered from loss of pain and pinprick sensation. So she presented with right-sided spasticity and decreased sensation to light touch. That's a right side affected motor pathways and dorsal column, while left side predominantly affected her ascending spinothalamic tract and sensation to pinprick. She informed me that she was pregnant. We went through the pregnancy, and after delivery, she come back to me with complaints that I have challenges with breastfeeding. When I breastfeed from one breast, my child is happy. However, when I feed him from another breast, he's not happy. I ask you to collect milk and look for how much actually milk produced by one breast versus another. And what it showed that day after day, one breast on the right side expressed about 60 cc's of milk, and another breast only 5 to 10 cc's. I was a little bit puzzled. I was far away from my OBGYN practice. That's why I had to investigate this issue. But at this point, I definitely recommend you to consult lactation specialist, and we started with supplementary food early in the postpartum period because it was not just sufficient to maintain child health. And this was practiced many years ago, 2013. I went back to the literature and I look what is actually typically women without spinal cord injury milk production. As you can see here, this is a paper published in 1996. Typical milk production from right and left breast are very similar. There are some changes, but very similar, approximately 400 cc's milk production from each breast. And unfortunately, in my case, differences in milk production was almost 83%. So it definitely was abnormal. Again, as I'm very interested in autonomic anatomy, I start to think about innervation of the breast and what's happening with milk production. And what you see in these diagrams that we have autonomic nervous fibers innervating predominantly blood vessels and milk tissue in the breast coming from upper thoracic segments from T1 to T5, and sensory innervation coming from upper cervical segments as well of T3 to T6. And as you remember from our INSCI assessment, nipple innervation area, it is a T3. And this is where my OBGYN practice came very helpful. I remember what is important for milk production, reflex known as let down reflex. And I would like to remind some of you what it is. When child starts sucking of the nipple, attached to the nipple, we immediately have activation of sensory receptor at the nipple area. And as I mentioned to you, through the thoracic spinal nerve roots, predominantly T3, this information will go to the spinal cord. It will activate second-order neurons, which will go up through the dorsal columns, reach hypothalamus, as the spinal cord is intact. And here what's happening magic. Oxytocin will be released from pituitary gland, and then through the blood circulation, oxytocin will come back to the breast, and milk ejection will happen. So there are two very important aspects in breastfeeding. Milk production, which required enough sufficient fluids, nutrition, but very important aspect of milk ejection. And it's happened with support of this milk let down reflex. Unfortunately, in women with cervical injury or upper thoracic injury, this feedback from the sensory receptor at the nipple is lost. Therefore, there is no oxytocin release occurring during the breastfeeding of the child in a woman with this level of injury, particularly above T3, and therefore no milk ejection happening. This is what's happening and now understanding at the present time challenges with breastfeeding in women with spinal cord injury. In our publications, we outline numerous tricks that we can use, excuse me, to help with milk ejections, but it's again very big and separate issue. What I would like to finish my presentation with some few take-home messages. We have to remember that women with spinal cord injury have rewarding sexual life. Their fertility in general is not affected. Pregnant women with spinal cord injury generally have successful pregnancy outcome, just like able-bodied females. And what is very important to remember, have a coordinated team in place and not afraid of questions. And this is a recommendation by one of my patients, Mrs. Karen Hodge. As you can see here, she holding her logo. I cannot do anything, but no one can do everything. It is okay for us to ask for help. So this is what important to remember, that we definitely physiatry team or TPT team together in Vancouver will always will involve high risk pregnancy team from the woman hospital when I learned that my patient with spinal cord injury is pregnant and expecting child and preparing for lactation and so on. So it's a team effort as always. We also have to remember that, yes, there are challenges with breastfeeding, but it's still possible. And do remember the level of injury and severity of injury could explain why some women experiencing difficulties, such as loss of a let-down reflex. Positioning for child is a very also challenging issue during the breastfeeding. And here, occupational therapists and physical therapists in my clinic are absolutely crucial part of discussion of these issues. Do remember about possibility of triggering autonomic dysreflexia with breastfeeding. And of course, I am a clinician scientist, would like to emphasize it's still poorly investigated area. We need more research on women's health. And this is one of the diagram from our publication in topics. This is a different positions that could help women, particularly with upper extremity difficulties and weaknesses, to hold babies during the breastfeeding. And this is fully explained in the manual. I would like to finish my presentation again with a saying by Karen Hodge, who is actually a social worker here in the local women hospital. Enjoy your pregnancy. I wish I had worries less and enjoy the experiencing more along the way. And I'm showing you the website where she has 18 suggestions and recommendations for women with spinal cord injury during the pregnancy and postpartum period. And finally, I would like to show, I believe I have enough time. Yes, we have plenty of time. It will be 5 minutes video which my team prepared based on the issues that we described in these two publications. And this video is available for free at the TSCIR community website. And this issue covered interviews with what my patients actually experienced during the pregnancy and breastfeeding women with spinal cord injury. I will start video and I will have just a second and show just José, we see right now a video.
They asked a lot about letdown, but again, my breast felt full, but I couldn't tell when my milk would start flowing. So there's all of those challenges. So having somebody that's knowledgeable, that's experienced, that knows more about lactation after spinal cord injury, so that they can give you more evidence-based advice rather than just guesses or assumptions, would be really helpful.
Women with cervical injuries tended to not experience the letdown reflex. And in addition to not producing enough milk, they weren't sure if their babies were satisfied after a feed because milk was not coming out and they didn't really feel the entire cycle of that reflex happening. For breastfeeding for spinal cord injury, the intercostal nerves from T4 to T6 it can be impaired. So again, that interferes with that reflex and the letdown reflex. So that may interfere with how well how much milk the baby can get. And it also interferes with the feeling, right, of having that letdown reflex and that something's about to happen.
In terms of blood pressure, after I had Riley, I had
very low blood pressure. Before I had her, I had very high blood pressure, like we're talking 200 over 100. That's why I had to get admitted. After I was dealing with like 70 over 30. So I was lightheaded, I was dizzy. So for what I had to deal with my low blood pressure was just reclining. So I had to be able to recline so that the blood could get back to my head. If not, like I could not see anything.
Simple task of sitting, which again, many people without spinal cord injury don't even think. It's not difficult. I can sit anywhere for how many times, for how long, doesn't matter. Individual with spinal cord injury, depending on the level of injury, sitting for a long time in the same position is a challenge. Why? Because arterial blood pressure is changing dramatically in people with spinal cord injury when they're assuming position from supine to seated. Typically, what we will see, blood pressure will drop, what we call orthostatic change in blood pressure. This condition typically associated with very unpleasant sensation, lightheadedness, dizziness, sweating, fatigue. And that's why for a woman who is planning to become a mother or who is trying to breastfeed, she has to sit for quite a while to keep quiet and nurse her child. This could be a challenge.
I don't have sensation at my nipple level, so it was hard for me to tell if we had a good latch or not. So I quickly, my nipples became damaged and bruised and were bleeding. Then I started having autonomic dysreflexia when I was breastfeeding. I tried to ignore that. I didn't really tell anyone that that was happening because, again, I was told there was no reason why I couldn't breastfeed. So I kind of attributed it to other things.
We do know from the able-bodied females that sometimes child could grab nipple quite strong. Woman without spinal cord injury will have pain and pleasant sensation for a period of time, but then it will relax. In a woman with spinal cord injury, this strong nipple grab by child could result in sensation that will trigger episode of autonomic dysreflexia, which is life-threatening condition. So this is another very unusual barrier and challenge in women with spinal cord injury when they're planning to become a mother.
Really happy that I had that support system, but mentally it's really hard when you're kind of feeling a bit stuck in bed and not back to your normal routine as you would have hoped. So I wasn't really super prepared for I think they prepared me really well for the delivery and the pregnancy itself, not for the after stuff that could possibly help.
Compared to the 13% of women in the general population who typically do experience postpartum depression, women with SCI were nearly 2 to 3 times as likely to experience self-reported postpartum depression compared to the able-bodied population. And that's huge. We don't know whether or not it's a result of their injury or maybe the extra barriers that they experience to breastfeeding and motherhood in general. It could be negative public perception of women with physical disability who do choose to pursue motherhood. But either way, what the study has shown us is that there needs to be a lot more support, both clinically and socially, for women who are undergoing breastfeeding with spinal cord injury.
Women sitting out there wondering whether or not they can have a sexual life, whether they can have a baby, whether they can be a regular parent like everybody else. The message is, yes, you can. So there might be some adaptations, there might be some barriers along the way, but most of them can be overcome.
The breastfeeding is a relationship. And that even if you're not able to breastfeed, make enough milk, that we would encourage you to still, spend time with your baby skin to skin and take that time to fall in love with your baby. And that any amount of milk that you can give your baby is a gift. And it is about that relationship and learning about each other.
What to do when women with spinal cord injury develop episodes of autonomic dysreflexia during breastfeeding? Don't be upset. Know what to do. go to find a specialist, physiatrist probably, and talk about what can be done in order to prevent developing of autonomic dysreflexia while breastfeeding.
So whether you have a spinal cord injury or not, some women have trouble with milk production. So there are medications that can sometimes help make that better. And sometimes there's some herbs, but really, I think the most important thing is to see either your doctor or your lactation consultant to figure out how you might be able to promote more milk production.
Thank you very much, everybody. And at the end, I would like again acknowledge and say thank you to all women with spinal cord injury who participated in this exciting for my team study. All my graduate and undergraduate students who work with me, and of course my collaborators around the world who helped me to develop this, I hope, very clinically useful and consumer useful documents. Thank you very much for attention. I'm ready for questions.
Thank you very much. That was great. That was great. So I encourage the audience to place their questions into the Q&A section. Think we have anything yet? Maybe just to get us going, I could ask you while people put their questions in. What do you like if we had to prioritize in terms of where we need to develop higher quality evidence? What would be some top priority research questions to your mind to move to
Oh my gosh,
further refine guidelines?
it's so big topic because every single issue is related to women's health. It's either case-based or anecdotal observation of clinicians or clinicians' opinion. That's why even when we're creating recommendations and guidelines, and colleagues, I will encourage you to look through the guidelines that we develop. Majority of our recommendations were based on our clinical experiences. We never had clinical trials. What medications could help, for example, women with spinal cord injury for milk injections? We don't. We're using, again, all recommendations from healthy population. So that's why practically everything, Jose, need to be trialed, investigated, and so on.
Fair. So in the meantime, how could in terms of awareness of the guidelines, what would you like to see, or what would be some steps that you think could increase awareness of the guidelines, especially, I guess, amongst primary care providers, and perhaps are there resources that mothers with spinal cord injury can use to bring to their care providers to help disseminate
As a
knowledge?
scientist, it's a good question. As a scientist, I'm always thinking, will be my paper in a journal reach audience which need to be reached? That's why from our team, what we discuss, how we can expand knowledge translation of these clinical practice guidelines. First of all, we develop these videos, which interactive videos, not just reading manuscript, but listen the true women with spinal cord injury experiences. And we made, I believe, 5 or 7 different videos on different topics of motherhood and breastfeeding. It is available. My team did a multiple presentation on national and international conferences, advertising the breastfeeding guidelines development and putting these videos out. And again, we try to put everything out for free, available, and hopefully if people Google breastfeeding in SCI, they will come to these documents.
I think it's a fantastic resource. Just again, encouraging people, if have any questions, to put in the Q&A. Maybe I'll ask you one more, some more conjectural, I guess. But I mean, there's a lot of interest in spinal cord stimulation as an intervention for a number of indications at the moment, especially transcutaneous stimulation. I was wondering if you think there might be potential there as with that or other things for new interventions that could perhaps alter the breastfeeding capacity of somebody after a spinal cord injury. Any kind of interventional approaches that you think would be worth looking
at? First of all, of course, it is attractive. I don't know. That's what we have to investigate. I do appreciate, I believe, ideas that this is, first of all, non-pharmacological interventions that definitely will be more attractive for mother who knows that no drugs will come through the milk to the child. That's why it's one of the possibility. And so far as we do know from the effects of transcutaneous or epidural stimulation, it's definitely will stimulate various circuits in the spinal cord, both sensory, motor, autonomic. Autonomic, at least we have evidence that it stimulates autonomic circuits related to blood pressure control, autonomic circuits related to the bladder, bowel control, autonomic circuits related to sexual function, both in men and women. That's why you're absolutely right. Maybe we should propose a clinical trial to increase milk production in women with spinal cord injury with spinal cord stimulation, probably mid-thoracic stimulation. Good question, but no answer, direct answer.
It's exciting when we have lots of questions. Good. All right. I think we're going to move towards wrapping up because I don't see any further questions. But before we wrap up, I would just like to share a slide from TS. Oh, there we go. It's being shared. So thanks to the Asia office for sharing that. These are a couple of our upcoming webinars in this series. So you can see we have one in February on biomarkers after SCI, and then one in April about neurogenic bowel dysfunction. So I highly encourage you to put those on your calendar and to plan to attend. The registration QR code is on the slide. Maybe we'll leave it there for a minute or two. Well, maybe not a minute or two, for say 20 seconds. And in the meantime, I would also. Oh wait, sorry. Something popped up in the Q&A. Oh no, just a comment. So lots of appreciative comments. Not seeing questions.
I will put on the chat notes link to the video. If people would like to copy a link to the video that I showed, and you will find together with this link other videos and other information related to breastfeeding and motherhood.
Fantastic. Thank you all. We'll leave that up there for a little bit.
Again, I truly appreciate this possibility. Oh, there is some questions coming. Oh no, it's just thank you, thank you. Yeah. Would appreciate these possibilities to talk about our study.
Thanks again for presenting. And to the audience, again, just a reminder, if you have upcoming work that you would like to disseminate to the spinal cord injury community, to think of TSCIR. It's a forum that has, that is central to the SCI community. So we would appreciate seeing your work and helping you to disseminate it.
See you all in San Antonio.
That's right. Okay. Thanks everybody for joining. Thank you, Dr. Krassioukov, for your presentation, and I hope everybody.
Oh, there is a question.
Oh, is there? Is there a question now? Oh yeah. Okay.
That's
Great.
a question is, where's breastfeeding and IdeaCure dynamic agents help? This is a very challenging issue because if you put dynamic agent on nipple, it will be going to the baby. That's why lidocaine or ketamine, I don't think so. We want to put it into the baby mouth. That's why this is never tried. We never tried. And
okay.
Thank you again, everybody. Bye-bye.
Thanks, everybody. Have a great day.